Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill-Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Kick COVID-19 to the curb. The go-to guide for fortifying your immune system and winning this germ war. By Drs. Angela Yakey and Kathleen O'Neill-Smith, also known as the FIRRIMup Doctors.
Drs. Yakey and O'Neill-Smith, in their new ebook, Kick COVID-19 to the Curb, provide a readable, informative guide for the general public to help understand the medical aspects of COVID-19 and to provide practical tips for self-monitoring and self-management. In the course of the book, the authors explain the extremely complex field of immunology with a combination of an effective analogy combined with clear illustrative figures. My favorites are Figure 3 on the immune system and the self-monitoring table on page 90. I will share the book with my family members and highly recommend it to anyone trying to get a better understanding of the medical aspects of COVID-19. This is Joseph E. Thornton, MD, Fellow of the American Psychiatric Association and Associate Professor of Psychiatry with the University of Florida.
That was a short clip of a review given by Dr. Joseph Thornton. Now I'll go ahead and introduce one of our FIRRIMup doctors, Dr. Angela Yakey. She's flying solo today without Dr. Kathleen. Dr. Kathleen got a little held up in clinic today, but that's okay. So now introducing Dr. Angela Yakey.
Hi, everybody. I'm so excited you're with me today on this Friday afternoon in the middle of a hot summer. And I'm really excited because, at least for my own community here in Gainesville, Florida, we've been together for 15 weeks. We started on March 20th, and many of you actually have been with me the entire time. So thank you. And you remember at the beginning, our goal was, as my private practice, North Florida Integrative Medicine, is to get all our 6,000 plus patients, the 303 people, especially high risk, through July 4th unscathed. And knock wood, we have just a few days and we're gonna make that goal. So I'm really, really happy to be here with you all today. And I wanna welcome, I know that I have people now coming in from Arizona, California, Boston because of Dr. O'Neill-Smith, the Northeast, and we're getting questions and calls from all over the country now. So we really appreciate you coming. And we really appreciate you. Many of you have actually read our guidebook, Kick COVID-19 to the Curb. So we're going to get started. And I thought it was appropriate that Dr. Joseph Thornton, University of Florida, a psychiatrist professor, he would do the endorsement, because today's topic, we're going to move to talking about food, mood, and the immune system. I'm just going to lay the groundwork, and as we develop the program, we're going to spend quite a bit of time. And I love food. I love talking about food. That's part of the reason why Dr. O'Neill-Smith and I love going to Italy, because we love their food, because their food is really wholesome and healthy. It's anti-inflammatory, and that's what we're going to talk about today for our FAQ. But again, welcome. For those of you, if it's your first time, Dr. O'Neill-Smith and I are so happy that you're joining us. We would love for you to spin this out to your friends and family. It's on Facebook Live. They can easily join at FIRRIMup Doctors Facebook. It's Fridays at 3 o'clock. Many of you received a survey this week. We wanted to make sure this time was convenient for you. It's Friday afternoon in the middle of summer from 3 to 4 p.m. And we saw that the viewership went down as we opened up, number one, and as the summer came on. So please fill out that survey. We want to continue to deliver this teaching, but we just want to make sure it's a time that's convenient for most people. So thank you for joining me today. Next slide. So here we are, June 26th, and you've seen these numbers grow and grow, but basically we are a hotspot here in Florida, and it's always been along the eastern seaboard as well as the western seaboard, areas that are most traveled. I'm going to talk to our group specifically about what's going on in North Florida. The data for Boston is there as well. I won't spend too much time on that, but we'll go ahead and go forward. So there was a Reuters article that published that based on serology testing or antibody testing, there's over 20 million cases of people who have experienced the COVID-19 infection. However, based on data, which is June 26th, total confirmed, at least with testing, COVID testing, is almost 2.5 million. Deaths are about 125,000. So most recover. In Florida, we've done a lot of testing, even in Alachua County. Over 1.7 million tests, 114,000 confirmed, 14,000 hospitalized, and relatively low number of deaths, considering that there's a lot of seniors and a lot of retirees in Florida. There's a lot of ALFs, assisted living facilities and nursing homes. Our deaths were only 3,300. So I'm going to hammer down into Alachua County. Confirmed are 863 and just 11 deaths. We're over 100 days into this in Alachua County. In our community at North Florida Integrative Medicine, 93 serology tests we've done for you all. We've done a combination of Quest antibody testing where we draw your blood and send it. And we've done point of care blood spot testing. We did 8 of them this morning where we poke the finger and we drip it into 2 vials. All of them were negative this morning. Nobody had experienced the virus this morning, but the combination of both, total of 3 positive, 2 immunoglobulin G and 1 immunoglobulin M. The one that was IgM positive we had done in the other building, and it ended up quarantining 6 of my staff 2 weeks ago. So we're now going to blood spot testing outside again in the morning. If you want blood spot testing, they're done Friday mornings outside now. The other thing we've done different this week, we're always innovating so that we can still care for you and keep you safe. So if you are in the high risk, red or orange, and we'll go through that again, red or medium, red is high risk, medium risk is orange in terms of risk for complications of COVID-19. We actually set up a tent right outside our lab door. So when it's cool in the morning, we can see you outside under that tent, because the transmissibility of COVID-19 virus is 0.4%, 4 out of 1,000. It's a lot less outside. And by the way, as you're getting ready for your Independence Day, July 4th celebrations with your family, please consider doing them outside in open air, and make sure that you're wearing your masks and at least 6 feet apart still. And if we're really concerned, then you want to make your own food and bring it to the picnic, okay? So I know that we're planning, I have a huge family in Gainesville. We're trying to figure out how we're going to do this. I know you're in the same boat. How are you going to celebrate in the middle of a pandemic? Well, I would recommend, number 1, outside. Number 2, wear a mask. Number 3, if you're at high risk, bring your own food. Okay. And then even in our office, when we have lunches brought in, there's one person in a mask with gloves serving everybody else. Nobody's touching the handles. One person is a kitchen person. So think about that as you get ready for your celebration next weekend. So in my opinion, we've done really, really well in North Florida Integrative Medicine at not getting COVID-19. And I'm really happy about that. And like I said, we only have 8 days till we make our major milestone as a community at North Florida Integrative Medicine that nobody died, to be honest. And knock wood, nobody got intubated. 2 almost got intubated. And the one that almost died is actually back at work. Praise be to God. Okay. So if you're joining us from Boston, thank you for joining us. They were 805,000 tests, confirmed were 107,000, hospitalized were about 11,000, and deaths were almost 8,000. So look at that ratio. So tested to deaths are higher than Florida. In Suffolk County, which is a busy county where Dr. O'Neill Smith works, and she's busy working, there were 20,000 confirmed just in one county with almost 1,000 deaths. So they are going to reach herd immunity quicker than Gainesville, Florida and Alachua County because they've experienced it sooner than we have. So go ahead, next slide. But I don't want to be alarming to you all. I would like to think that this webinar is actually giving you hope and giving you a sense of control, because as Marie Curie said, that understanding gives you peace, right? If you understand what's going on, then you can have a piece of what's going on. It's when, just think about it. 15 weeks ago, those of you who've been with me since March, early March, remember when it was a big black box of unknown? We didn't know who was infected, how they were infected even. We didn't know about the children. We didn't know about the grownups. We have a lot more science. We have a long way to go, but we have a lot more scientific knowledge about this virus called SARS-CoV-2 than we did 15 weeks ago when we started this. And look at the data here. So this is actually reported US COVID-19 daily deaths, good website, covidtracking.com/data. So basically, if you're going to have a complication of cytokine storm, and I'll show you some pictures, which is the usual cause of death, you're usually going to die about 3 weeks after the date of infection, okay? So look at what happened here. Daily deaths and deaths in a 7-day average. So basically, remember back when we started our journey together, we actually started doing outside evaluations about March 12th on those drive-up evaluations with that YouTube that went viral, 4,000 views, 3,000 within 24 hours, how to do it outside your office. But look at it, this is March 14th. And then this was our first webinar together here on March 20th. And look at how the curve went, deaths per day, it went up. And then now it's actually coming down. And the death rate in Alachua County, because I don't want you guys to be fearful, is actually pretty low. Especially, I want you to fortify your immune system as you're starting to mobilize. But the death rate in Alachua County is even lower than this. So here we are, if you can't see it, way over here on the left again is when we started our first webinar was March 20th, right here, March 20th. And then you see how the curve goes up like a mountain. Okay, remember it was really bad in New York, okay, in April 23rd, keep going. And then it's starting to come down now, kind of downhill of the slope. We have a slow burn now, keep going. So that the actual death rate in Alachua County is quite low. Okay, so we're June 26th. So I feel like we've made it over the hump. There's some special aspects to North Central Florida because the students and the college kids coming back potentially that I'm going to be talking about, especially during the Q&A. So next slide. And here it is, Alachua County, which for those of you all who don't live in Gainesville, Florida, Gainesville is in Alachua County. So here are the statistics from this past week. So look at this, it's really hopeful. New hospitalizations, there was one on Saturday and one on Sunday and one on Tuesday over there to your left. New hospitalizations, over the column all the way to the left, okay? And despite a lot of testing in the second column, a 7-day total of positive tests were only about 200. On the other hand, there were over 5,000 negative tests. So if you look at it, out of the total number of cases and total hospitalized, the rates are like 11%, okay? Initially, remember we were saying quoting that would be more like 20%. So that's actually better than the Wuhan experience. And look at the death rate is 1.4%. Okay, that's not bad. You know, that's actually, it's, first of all, any death is bad. But compared to what we as a community were looking at on March 20th, this is looking better than what we thought. Okay, so what I anticipate will happen will be this slow burn, that we're not going to overwhelm our hospital system. Remember that? Where the concern was we would have ventilators in the cafeteria, which they experienced in New York City, by the way. And in Boston, they actually had to open accessory hospitals. I don't think that's going to happen in North Central Florida. We have to be careful though, because there have been communal gatherings, and especially with the young people. And I'm going to address that specifically because I've been on call this past week and I've had so many calls about exposures, but I'll share you a few cases in a minute. But next slide. And really, what are we talking about? What is the cause of death related to COVID-19 infection? It's the lung problem primarily. On the left, you have a normal lung CAT scan. It's where a bread slice has gone through the thorax, and those arteries are the pulmonary arteries, the two holes in the middle, and the heart is that white part above, okay? Well, that's normal, where you have normal vasculature, which is white, and black are like the balloons that aerate the lung tissue to give you oxygen. The trouble with this particular virus is that, sure, that can happen to you on week 1 where you have cold symptoms and your lungs are normal, but usually week 2, if this is going to happen to you, you activate what's called the inflammasome, where your own immune system, your immune system army, is what we talk about in our guidebook, becomes over exuberant, and it's an uncontrolled immune response where the immune system army is too strong. And that there's a result, because remember this, we consider this virus a vascular problem. You actually get mini blood clots. You get a lot of what's called exudative debris, which is protein and dead soldiers, dead cells. So there's pus and protein, many blood clots, and fluid that make it look like the image on your right, and it feels like you're breathing against cement. So that's the cause of mortality, the 2%, at least in our county. That's what you do not want to get. And based on the New York experience, mostly it's men, older men, so over 65-year-old men who are obese and who have metabolic syndrome, which is prediabetes or diabetes. And we're still trying to sort that out. In addition, if you have underlying lung disease, asthma, emphysema, or if you smoke, like some of my patients that I said, this is not the time to smoke, it can open the barriers in the lung, allowing the virus to cross more easily, and that's not a good thing. In addition, if you have kidney disease or any other chronic cardiopulmonary disease, like cardiac disease like atrial fibrillation or previous heart attack, or cardiomyopathy, meaning a weakening of the heart muscle, be it from a virus, because viruses can cause cardiomyopathy, or a previous heart attack. If your heart's already weak, we know the virus attacks the heart directly 2 out of 10 times, and that could put you at risk of complication of death, actually, from this virus. So in our heads, we're always trying to think how to decrease the baseline inflammation so that you're not susceptible to getting not only this condition, but other conditions that are caused by fire or inflammation. There are things called biomarkers, and I know Dr. Kathleen and the Gainesville crowd, we do a ton of biomarkers. These are lab tests that tell us whether or not you are inflamed or whether or not you have vasculature problems. And so I'll just share, I've had a busy clinic day already, so I'll just share a couple scenarios actually a particular gentleman who, he was fine with me teaching the intern, so I'm sure he'd be fine without saying his name, but I'm going to show you an example of what I'm talking about. So when we're talking about understanding if you're baseline on fire or if you have rust or oxidative stress, which can lead to immune problems such as this, then we need to know about that beforehand. For example, fire is inflammation. Those are biomarkers. You might know them because you see us. That would be HS, or highly specific C-reactive protein. That could indicate fire. The other one is called F2 isoprostane. Okay, there's no test. You don't need to write this down. Just realize there's blood tests that tell me whether or not you have baseline fire. A SED rate will tell me whether or not you have baseline fire. The other thing that will tell me if you have baseline fire is a loss of certain things that take out the fire, such as omega-3 fatty acids. If you have low omega-3, it means you used it up or you're not eating enough fish, okay, or fatty acids that are healthy. So those are clues that someone's on fire. So I have a 70-plus-year-old man who's a farmer. He works 16 hours a day outside. He's lean. I didn't like his cholesterol, and he was pre-diabetic 2 or 3 years ago. He totally changed his diet, does everything we're going to talk about, and he's great. So I'm trying to fine-tune him, so to speak. So his HSCRP was 1.2. It was high. And I looked at his omega-3, so I gave him fish oils to decrease his inflammation, because he's the exact person, minus being obese because he fixed that through exercise. He's a man who's 70 something. If he were to get COVID, he'd be at higher risk for having a complication. So I got the fire out. The second thing I did was I checked to see whether or not he has vascular problems at baseline. And he has white coat hypertension. Whenever he comes to see me, his blood pressure goes up. Well, we're now told to pay attention to that, to not ignore that, because that can mean vascular problems later. So we have a very sophisticated blood test called ADMA, and his ADMA was high. So I knew that he had a potential vascular problem. So I knew to check his nitric oxide. So it's a very simple test. It's a spit test to tell me if he had low nitric oxide. Nitric oxide is the gas that opens up the vessels to deliver oxygen. In my high-risk people, or in people that I'm concerned about, part of their individual telehealth or in-person consult is to have them spit on a strip to tell me whether or not their nitric oxide gas is depleted. Because you can imagine if you were to get COVID and you're not delivering oxygen well because your arteries are not dilating like they should to deliver oxygen, that would put you at a disadvantage in this situation. So I did his spit test. He spit on a little felt tip, a little indicator that's about this size. He spit on it, and I saw it came back very light pink. It should come back almost purple if he has appropriate nitric oxide. So his was very light pink, indicating that he's depleted with nitric oxide. Okay, so there's a guy, a PhD doctor named Nathan Bryan, Bryan. He trained under the Nobel Prize laureate who found nitric oxide. He developed a supplement called NO-Pro that increases nitric oxide. So I put this gentleman on it. It's used twice a day for a month, and then he's going to come back, and I'll have him spit again to make sure his nitric oxide is high. In addition, he's going to eat beets, because beets increase nitric oxide to deliver oxygen by vasodilating or dilating arteries. So this is one maneuver that we can help you do to fortify your system just in case you get sick, number one. Number two is I was teaching the students in my clinic today that all aging has to do with trouble with vasculature. So this is a good thing regardless of COVID, is to fix his vasculature. So if you think about it, low blood flow to the brain, that's dementia over time. Low blood flow to the kidneys, that's chronic kidney disease. Low blood flow to your extremities, that's when your feet and hands have low blood flow, they're blue. That's not a good thing. Low blood flow to the heart, well, you know what that means. So blood flow is very, very important. But especially with this, what we consider, Dr. Kathleen and I consider a vascular infection called SARS-CoV-2, which causes the COVID-19 disease. So with this gentleman, I encouraged him to eat 10 fruits and vegetables a day, emphasize omega-3 fatty acids in cold water fish. He was already taking 3 doses of salmon per week. But I asked him to eat at least 2 beets a day. And if you eat this many red beets, realize that your stool will look red and you're not bleeding. You're not bleeding, okay? You're eating the beets. So that will set the stage for the FAQ 13 for this week. And I want to let my community know here in North Central Florida, as well as Dr. Kathleen's community know, that we're actually going to be doing, developing some programs on food, mood, and your immune system. Because we actually spent, the story of Dr. Kathleen and I is, we've been working on the immune system for 2 years. We presented in Italy at the controversies on rheumatology and autoimmunity in March of 2019. That's when we actually started our textbook called Fine Tune Your Immune System. But a major part of that is actually the gut. And a major part of the gut is food, obviously. Food is very, very important that you eat clean food. If the gut's inflamed, your immune system's going to be inflamed and confused. You need your immune system to be healthy. We taught on an earlier webinar that despite your chronological age, we want your immune system to be younger and healthier than your chronological age. Many of you know I turned 50. So I'm actually going to get what's another spectra cell analysis. That's SPECTRACELL. And that is actually partially covered by Medicare and most private insurance now. Spectra cell analysis will not only tell me my lymphocytes. Lymphocytes are the queens, remember, in our immune system army. It'll tell me within my lymphocytes how my nutrition is. How are my micronutrients? How are my A, D, E, K, magnesium, manganese, copper, zinc, okay? So I want to know that. But it will also give me a score on how those cells fight compared to other 50-year-olds. So you don't have to guess. So what we said was true. You can modify your immune system so it does not have to be your biological age. Cross fingers, I'm hoping my immune system age is closer to 30 because I know the peak of health occurs about age 35. And they generate this beautiful report. I did some telehealth this morning, and basically you get a report. It'll say immune system. And then this particular lady this morning, it was quite surprising. She's been a lovely patient for 20 years. I don't think she'll mind if I tell you this. So she's in her 60s, does everything I say for age management. She's been my patient for 20 years. She unfortunately has a condition that's precancerous, kind of blood condition potentially. So when I looked at her immune age, it was actually better than her biological age. So that was reassuring. Okay. So anyway, the 2 things that the spectra cell analysis reports that I love is it tells you your immune age compared to other people, but it also tells me your antioxidant level. Remember what I was saying, the way to age a body fast is to have fire or inflammation, oxidative stress or rusting. They cause immune problems, but the reverse is true. If you have immune problems, it will cause fire and rust. So what I think that this particular blood test spectra cell analysis does well is it reports an antioxidant overall score. And if your antioxidants are low, and I need to get them up for a certain reason fast, then I give you intravenous nutritional therapy, which is a subject for another talk. Or if you have a healthy gut and you're young, and I'm just trying to fine tune you as you enter into your 20s, 30s, and 40s, then I would route with food. And if food's not enough, I do nutritional supplementation. If that's not enough, then we do intravenous nutritional therapy, IV&T. But always use the gut. But the trouble here, when we spin in food and aging well, we're going to be sharing with you all what we think about American food and how our food sources have trouble. Now, those of us who are blessed to live in Alachua County, there is a healthy food market open even during the pandemic, at least even on Saturdays and then 1 or 2 times during the week, where there's local farmers markets where people bring in their food and they tell you that they're organic. I think they're trustworthy. They just can't afford, because they're small farms, to pay to be certified organic, non-genetically modified. And you know it for yourself. I know it from my own history of buying food from these places, that they're just picked and they're fresh because A, they taste different. So the men in my family are willing to eat it because they taste better. And B, I know you guys are just as busy as I am. There's been times where I've bought sprouts from the Hale Market on a Saturday morning, put it in my garage refrigerator, forgotten about it for 2 weeks, and they're just as fresh 2 weeks later. Because they were so fresh, they were just picked. They're like, no problem. They were just growing in my refrigerator. So that's point number one, is you want to eat live food. Don't eat dead food. Don't eat processed dead food that literally you want to eat on the outskirts of your grocery store, or better yet, eat from the farmer's market. You put garbage in your body, you're going to get garbage out. Nobody is perfect. We eat 3 meals a day. That's 21 meals per week. That's 1,092 meals per year. That's 5,460 meals in 5 years. So we have plenty of opportunity to eat well. You can have a cheat day in my practice. You can have a whole cheat day. That's 3 out of 21 meals, could be whatever you want to do. Unless, of course, you're diabetic or you're allergic. But most of my patients, I give them a cheat day, because my other friend is Dr. Anna Kabeka of Hormone Fix fame, best-selling author of Hormone Fix, and now Keto Grain 16 is going to the top. We do her group medical visits, which, by the way, if you're in our practice, we're rolling out another series in a month. But anyway, because we're the beta test site for most of her food type work, I was telling her that the concept that I was telling her from my experience with our own patients is that people have restriction fatigue when it comes to eating, especially, so that you have to give them a break to be able to eat what they want to eat sometimes. But it's consistently bombarding your gastrointestinal tract and immune system with the sad standard American diet, McDonald's, prepared foods, packaged foods, preservatives. You can't even pronounce it, let alone spell it. Why should you put it in your body? Your immune system doesn't know it. These can activate the inflammasome. That's what I was trying to explain. The reason why we think the children are getting weird autoimmune conditions, the very few children, by the way, statistically, that are getting COVID-19 infection are getting sick, and it's an immune problem. And then the adults in the 30s, 40s, 50s, not many of them, but certainly the older adults, is that they have baseline fire. They have baseline fire or inflammation and immune dysregulation. Well, what if I told you that what you put in your mouth is information to your genes and your immune system? I would hope that if you're in Dr. Kathleen's or our private practices, that you know that already. And thank you, all of you who are joining, who are not, because we consider you now in the FIRRIMup kind of global practice, that please realize that food interacts with your genes, interacts with your immune system. And it is really well known now that sugar is inflammatory. You know that. Those of you who are teachers or are moms, you give a kid sugar and how hyper they are, right? It inflames the brain, inflames the body. I have many autoimmune patients, people who have immune condition, who tell me one meal and their hands hurt. They can't close their hands. The other thing that causes inflammation are fats that are saturated fats, animal fats, or fats that are manufactured like margarines. They cause inflammation. And maybe we'll do a whole session on healthy fats. We love talking about food, but I'm just setting the stage for what we're talking about. We're trying to decrease your inflammasome. So for now, think about 10 fruits and vegetables a day, avoiding sugar and saturated fats and fake fats. Eat the avocados, eat the coconut chips, eat the butter, to be honest, unless, some of my patients have heart disease, have angina. That's a kind of an individual telehealth conference. And by the way, those of you who have been kind enough to join us who are not physical patients in our practices in Gainesville, Florida and Boston, we are taking you all as telehealth clients. We're essentially coaching you on health, and those are available. You can just email us at FIRRIMupDoctors.com. That's FIRRIM updoctors.com. And we're doing a lot of telehealth visits now for people who are not in our localities. To become a patient, we have to examine you at least once a year. All right, the other thing to note is that constant grazing increases endotoxemia, meaning you don't want to graze. In fact, periods of fasting are so important. You might have heard those terms. Those are called intermittent fasting. Intermittent fasting. We teach on that. We even teach on a well-researched type of fast called the Prolon, Prolon, the Prolon, Prolon fasting mimicking diet. We'll do a whole webinar on that and how that decreases inflammation and cellular aging. And if you look at our website, next week we'll have that available as well. But it's really important that you're not eating all the time. Your cells need to have time to go into autophagy, where it has cellular cleanup of the fire and the rust. Fasting causes you to burn fat, going into ketosis. Ketones are like jet fuel to the brain, as opposed to gasoline. You want to go with the jet fuel. Going into ketosis not only will shrink your belly fat, get you bikini ready for the summer, but it will make your brain better. Okay, but again, that's taught in a course called Keto Green 16, but you can just buy Dr. Anna Cabeca's book, and she's got online support. It's also available at our website, FIRRIMUpDoctors.com, her Keto Green 16. If you get it through our website, you actually get a bunch of bonuses from her. She's one of Dr. Kathleen's and our best doctor friends. She's one of our doctor girlfriends. And maybe in the chat, you could put the link to the YouTube we did with her, the actual webinar we did with her 2 weeks ago, so that you can look at it. But anyway, when you go into ketosis, you clean up old and damaged cells. Well, what do old and damaged cells mean? It means aging and feeling tired and causing cancer. You do not want to have old and damaged cells. You need to have time for your cells to do cleanup. It's like if I left my clinic open 24/7, it would be dirty because then the cleaners didn't have time to clean it up. Same with your cells. How does that feel? How do old and damaged cells feel? How about this? I hear it every day. Tired, brain fog, aches and pains, can't move, can't think, can't sleep, low optimism, depression, aging skin. I take care of a lot of women. Aging skin, I just look older. Why am I looking so old? Why am I feeling so old? Why am I gaining this much fat? How come I can't make a decision? I really want my brain to work well, and fasting is the key to making your brain work well. But in addition, you'll get a reboot to the rest of your body. So fasting is critically important. We'll be doing a series, like I said, on food, mood, and the immune system and aging. That's coming down. It'll be in the webinar format, but we'll also do deep dives through our own practices. So I hope you know the message here is chronological age is a modifiable risk factor for COVID-19. Meaning I'm 50, but I could do a lot of things in my body to get not only my immune system age, but my cellular age to be closer to peak, which is 35, okay? So when we do these things from a food standpoint, food first, nutritional support, IV nutritional therapy third, if that's what we need, we signal our cells. These are called medicinal signaling therapies. Food signals your cells in the right way. We can actually improve our immune resilience. What does that mean? Become like Teflon, become like Wonder Woman's band, so that if COVID's coming your way, you're bouncing off. You're like those 20 and 30-year-olds who never even knew they were sick, who have antibodies. There's a lot of them out there based on the Reuters study. There's a lot of them out there who never knew they were sick, who have antibodies. That is immune resilience. And because our immune system's older after 40, that's why if you're over 40, you have a higher risk of not having immune resilience. but everything we've taught you during these webinars help you have immune resilience. Okay, so now we're ready for Q&A. Nicole will pitch them to me and then we'll go to the chat and then we'll wrap it up.
Yep, so we have a few that have been set in prior to the webinar, and then we've also had a few come in through the chat box. So we'll go ahead and start with this question. It says, is it true the increase in cases are mainly in the younger population? If so, how does this affect us older and medium to high risk folks? Should we keep sheltering in?
Oh, wow, that's a good question. That's great. Okay, thank you. Okay, so for those of you who were not on previous webinars, I do want to show you this grid because this is phase 2 in Florida, phase 2 in Boston. People are moving out, okay? So let me orient you, and for those of you who've been through previous class and already know it, just bear with us so I can orient those who are just joining us now. On the y-axis, we look at risk of death from COVID-19, okay? Low risk is if you're under 40 with no high risk conditions, and those high risk conditions are what I said. Those are autoimmunity, those are heart disease, arrhythmias, asthma, diabetes, morbid obesity, those are high risk. So under 40, those are most of the kids in my office, the interns, the pre-meds. Okay, medium risk are middle age or less than 40 years old with a high risk condition. And so that's the upper, that's on the x-axis at the top under medium, where it's yellow on the top level. Nicole, if you could drive the mouse. Basically, those are people who are like my interns who actually are working remotely because you might be 25 years old, but you have ulcerative colitis and you're on immunosuppressive drugs. Those are medium risk. I have them working remotely, or you're middle age, okay, with a condition of any sort. All right. So then you've got the high risk people. These are the over 65-year-old people with comorbid conditions. These are the chronic care management patients, the 303 patients in our practice I was most worried about that we're getting through to at least July 4th. And then I call that COVID summer A. I made this up. And for our practice is COVID summer A. COVID summer B is actually July 4th to Labor Day, which is September 7th. So anyway, those are the high risk people, or if you're middle-aged. So if you're 50-year-old with a stent, a heart stent for cardiovascular disease, you're also high risk, okay? Then on the left, occupational risk for COVID-19. These are people, whether or not they should be mobilized and go back to work. We spent most of our consults talking about individual consults for people who are medium or high risk, whether or not they should go back to work. So basically, the question was, are most of these positives in the green people? Yes, we're doing more pan testing. We're doing more testing prior to joining university, at least in Gainesville. They did 4,000 tests last week. For you're not allowed on campus unless you have a COVID swab test. So what we're finding is that, yes, there's a lot of younger people under 40, healthy, who actually, in my opinion, should be serving the community. Otherwise, we're frozen. So these are the younger people who should be working and serving the community. These are the young people you meet in our office, for example. So they're in the green, but what they have to be, if they're in the low risk, they should be mobilized in the community, but follow CDC guidelines for facial covering, hand washing, and physical distancing. The problem is that some of them are not, and that's lack of care of the entire community. And I think that's wrong. And if they're related to you, you should call them out on that, because you don't know what the immune status is of the person next to you if they're Publix. You don't know if they're 40 years old with Crohn's disease and are on immunosuppressive and they're actually yellow. So if you're green and you're blessed to be green, you want to be ultra considerate of other people, okay? And continue to physically distance, even at the beach, even at the parties. You need to consider this for other people. Okay, so if you're yellow, medium risk, okay, those are the people we've been doing telehealth conferences with. We've made mutual decisions to activate family medical leave acts on some people just for their safety, etc. We've talked about play dates for younger moms who have immune problems. I mean, it's been a busy week. So the yellow people have a lot of questions. Can I go out now? And if so, what can I do? Okay, those are individualized discussions, but take all the precautions for the low risk people. Now, if you're high risk, at least in my community here in North Central Florida, because the seroprevalence is so low, number one, In our practice, less than 2% for sure. In Gainesville, it's around 5%. In Boston, I hear it's around 15% seroprevalence, and you need 60% to make herd immunity. You need 60 out of 100 people to have antibodies so that the virus doesn't jump from person to person to person. They've achieved it in Lombardy, Italy already. We'll talk about that another webinar. We're far from it, at least in North Central Florida. So if you're high risk, until we have herd immunity, number one, or number two, until a safe and effective treatment is found, where if you get it, no problem, we treat you, you're fine, or a safe and effective and sustainable vaccine is found, then you are still to shelter in. Okay, for our community, 303 high-risk patients in our community, we need to realize it will take 3,600 patients out of 6,000 patients to have antibodies within our community at North Florida Integrated Medicine to have herd immunity. We are very far from that right now. And so I'm asking you to shelter in. All of you all have been meeting with our telehealth teams monthly, okay? Many of you are stir crazy right now. So I made a special type of visit, especially if I'm worried you have cancer or something. I actually put a tent outside our office, right outside the lab door, where you're still gonna be seen outside under a tent with fans sitting next to us. We'll be gowned up and everything to protect you. We don't need to protect me, to protect you. So, you know, I've had a high-risk person who I'm worried has a cancer lump. Guess what? I'm going to do that type of visit next week because I have to decide what to do with that lump. And that's hard to do on telehealth. So the answer is, you know, in our practice, if you're high risk, because we've told you you're high risk, you're actually on the chronic care management program, or you're over 65 and you have more than 2 comorbid problems, you're high risk. If you're not sure if you're medium or high risk, make a telehealth appointment and I can tell you what you could do. Okay. So that's the answer to that. Next question, Nicole.
All right, so this person sent in a little bit of information about how they've been feeling. They say, I first developed COVID symptoms on June 20th, so this is day 7 for me. I have your book and have been using the symptom chart to track. I haven't got a nasal swab, and my intention is to get an IgG antibody test. I'm thinking I'll do it on my day 14 to be on the safe side. Is my thinking sound, or would you suggest another approach?
Oh, great. Perfect. Thank you for asking that question. Okay. First of all, you have to realize 80% who get COVID-19, 80% of people who have COVID-19 have minimal to no symptoms. Most can be treated by the computer. Out of the 6 positive people in our practice, all but 1 were treated by the computer and me. I managed the COVID patients, okay? Because I knew how to manage them. I mean, I did like major stuff. I said, okay, let's do the PRP spray, colostrum, proline-rich peptide. Let's do 3 sprays 8 times a day. Let's give you biocidin. Let's give you silver. Let's do, let's quarantine within your own house. Let's do high dose C. Zinc when you're sick goes up to 100 milligrams, C 4,000 milligrams. D 5,000, even 10,000. So I managed most of our patients at home. Dr. Kathleen, the same. Okay. So I'm just going to talk in general. If this is a young, healthy person, or even middle-aged, healthy person, you are low risk of having complications needing hospitalization or even an emergency room. You know what I'm concerned about? If you go get tested, you get COVID from getting tested. There's a place in town, I sent someone on Sunday to get tested with a COVID swab. Well, guess what? She hung out in that lobby for 2.5 hours and then heard through the grapevine that one of those was positive for COVID. So guess what? Even though her COVID swab was negative, I have her on the 14-day monitoring guide to monitor her for COVID. I saw her this morning and she's, thank God, okay. But she could have gotten COVID getting tested for COVID. Remember when I was doing drive-up evaluations? I realized after month 1 that I should change my jumpsuit in between each patient that had COVID. So it was hard. It was hot. I was changing my jumpsuit. So there's plenty of places in town to get COVID swab testing. So I don't COVID swab anymore, but I'm doing antibody testing. And the presumption with antibody testing is that you're well. Only if you're well should you get antibody testing. And the earliest you should have antibody testing is as our student, thank you, I'll call you a student because you read the guidebook. Thank you for endorsing the reason for the guidebook. Here's the picture. And this is hard to see, but I didn't know this question would come up, so I didn't have a slide prepared, but you all have seen this before. It's at day 14 that you start developing antibodies after symptoms. It's day 14. So you are right. You should get antibody testing at day 14, which is about here, okay? But it's also about that time if you're gonna have what's called a secondary complication, that you're gonna start having lung problems sometime between day 10 and 14. And again, in our book, it said get a temperature, a pulse oximeter, so you can monitor your oxygen levels, right? Pulse oximeter. If you can't, there's a cheat on that. I don't know if I told this community the cheat on not having a pulse oximeter. I will in a minute. And a blood pressure cuff. That's how we manage COVID, by telehealth. And again, I agree. There's no reason to get swabbed unless there's someone high risk in your vicinity who you're deciding whether or not to quarantine if you're healthy. Okay, so do a blood spot or do an antibody test. Check IgG and IgM. IgM, you're in the middle of it. IgG, you've gone through it. Okay, so yeah, I hope that answered your question. And don't forget, vitamin C, D, zinc, PRP spray, and you can order all this and we could ship wherever you have it. Just email us and we could ship it to you. But thanks for endorsing the guidebook because you're using it. The other thing is that for those of you who don't have the guidebook, you can get the guidebook easily. Just go to our website and you can get the guidebook. But we've offered the 14-day monitoring guide free on our website. If you give us your email. So I've told so many people who've called in, emailed, you know, that just go on the website, give the email, and you'll get a 14-day monitoring guide, and you should share that with people in your community. Thank you for that question. Next question.
So it looks like we have time for maybe one more question. Someone wrote in saying, someone had told me that their doctor suggested not getting the first round of the immunization that comes out. What's your opinion on that, and why might they have said that?
Oh, I would never be in the first round of a vaccine. I'm just going to tell you, I only speak from my experience. I'm not bashing any vaccine. Dr. Yehuda Schoenfeld, who is the world premier immunologist in the world, we went to his conference. He wrote the endorsement for our guidebook. This is him. I had emailed him 6 months ago because I had 2 young men who got the Gardasil vaccine, and one developed total bone marrow failure. The other one developed type 1 diabetes, and it was definitely chronologically related. So when you take a vaccine, if you have any predisposition to having other kinds of immune confusion, it could really confuse your immune system. I only said that because A, they said that I could report them to the adverse vaccines, but B, they said I could present on them in Greece. Actually, that conference is in Greece now. It got moved in December. If it's safe to travel, Dr. Schoenfeld wanted me to present their cases. Okay, vaccines, once they're stable, are reasonable to use, but you know, the young healthy people should be trialed on those vaccines, in my opinion. I'm very protective of our own patients. I don't want you to be in the first round of vaccine trial.
Okay, we can answer one more quick question and then I'll go ahead and close us out. If we're walking on trails, do you recommend wearing a mask?
Yeah, but I do want to say, you know, I see there's a lot in the chat room, Nicole, and I'd feel bad if we didn't try to answer some of these. I'll try to quickly go. I see the chat, so after I answer that, I'm actually going to jump right into the chat because I want people to get their answers. Okay, is that okay with you, Nicole?
Yeah, and whoever doesn't get answered, we can answer it next time or hop over to Facebook and answer more there also.
Okay, perfect. All right, so when you're on a trail, okay, so I was driving home just thinking what an interesting world this is. I saw people at the bus stop with a heavy black mask. It was 100 degrees outside, and I'm thinking that dude should lower the mask to his ear because he doesn't need it. He needs it when he gets on the bus. And you know, 5 people on the sidewalk all had masks. No one was around them. So if there's no one around you, you don't need to wear that mask. It's when the people are getting close to you, you need to wear the mask. Okay? You need to wear the mask when you're around people. So if the trail's empty, you don't need it. If the trail's a bunch of people, you need it. Okay, perfect. I'm going to go ahead and fly. And those of you who are my patients, you know how fast I fly. So thank you, Robin. Yes, we need to send Robin a survey because she didn't get the survey, but she thinks that a better time for this webinar would be 5:30 p.m. on a weekday. Thank you very much for that. Let me keep going here. Yeah, my thoughts about the increase in cases in Florida. We're like a center, but we're doing quite a bit of asymptomatic testing. Those are my thoughts on that. I would act as if, as we talked about on the earlier webinars, act as if you have it, act as if your family has it on July 4th. You would need to act as if. The only place I don't act as if is in my own house with the people I live with. Okay, act as if someone has it or is carrying it. Remember, we said there's a 40 to 45% asymptomatic rate. Okay. All right. Let's talk about the fall. Someone said here, Kim said that she had a flu-like symptom in November. She had antibody testing. It depends on the brand. So the blood spot that I use is by SD Bioscience, and it's 97% sensitivity and 97% specific. Now realize, to my community, I had access to those Chinese not regulated antibody tests way back in March. I just wouldn't do it because I didn't have the data. So if you have symptoms again, then get retested. Okay. Robert says, do you suggest I get tested if I came in contact with someone who had contact with someone who tested positive but tested negative? Okay, so a second degree contact. Robert, you need to get a 14-day monitoring guide, and if you have any symptoms at all, you should probably get tested. And where do you get tested in town? We're sending people to the health departments. They're free, and the outlying health departments are easier than Alachua County right now. Those are Columbia, Putnam. The outlying counties are easiest to get swabs, and they're first come, first served, but they're quite easy to get done. Okay, so 14 days, yes, you want to wait 14 days and then you're free. Now, some people's symptoms actually and infectivity could last longer. If you look at the curve, it's up to 3 weeks, but in general, it's 14 days. Yes, the 14-day monitoring guide is on our website. You can download it for free or buy our guidebook. If you get our guidebook, feel free to share that, screenshot it. The ebook is available, and you can screenshot the monitoring guide. It's on page 93 and send it anywhere you want. Okay, I think I answered all the questions. Yay. Is there anything else, Nicole?
Nope, I think you got through those.
Okay, everybody, thank you for coming. I'll see you one more time, July 3rd from 3 to 4 o'clock before our big happy day, July 4th. So happy to be in this with you. And Nicole, thank you. I'll let you take it from here.
All right. So just to wrap up, I'm going to explain kind of our summer special that's going on. So with the purchase of one of our paperback guidebooks, you'll get 20% off of these supplements, which are the ultra potent vitamin C, the zinc AG, the vitamin D, the Numedica PRP spray, Olive Defense, and Thymus Complex. To get any of these, our office will be taking orders until 5 p.m. today. You can email nfimgmv@gmail.com and place your order there, and someone will contact you. Or you can call our office at 352-332-6680, and someone can get your order also done then. But yeah, we'll be taking orders till 5 today. This is a limited time only summer special while supplies last, so you don't want to miss out. And like she mentioned, our book is available for purchase on FIRRIMupDoctors.com, FIRRIM Up Doctors. And right on the home screen, there's buttons on the little left side of Dr. Heath's picture, where it'll take you to buy the paperback. You can also buy the ebook, which is through Google Play. And then also when you go on the website, like she mentioned, if you put your email in, there's like a pop-up when you first go on. It has a picture of the book. If you just type your email in, you'll automatically get an email with this 14-day monitoring guide that she was talking about. But yeah, if anyone has any other questions, you can just email the nfimgmv@gmail or call our office. And we thank you all for coming, and we hope you join us next week. Everyone have a great weekend.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out.
The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.